Hi, I'm Dr. Cynthia Hudson, and I'm with Texas A&M Health Science Center, and I'm here to talk to you about REAL. Race, ethnicity, and language in the training that you're having today. You just watched a video of Michael Jackson called Black and White, and perhaps you're wondering why you were watching that video. And so I would say to ask yourself, why does race and ethnicity or the language that someone speaks matter? Because in part we say that it shouldn't matter, that all people are equal. And if you looked at the end of the video, if you remember that, everyone kind of merged together because we're all part of the human race. Yet in healthcare and providing health services, to some degree, race, ethnicity, and language does matter. Why? Because the information we have about our clients helps us to provide the best possible care for them. What we've been finding is that providers and support staff are not always asking the questions that they need to ask about race and ethnicity. So I wanted to talk to you a little bit about why it's important and what some of the assumptions are that we make, and the fact that those assumptions can be totally wrong. So people come in and we assume that there are a member of a specific race or ethnic group because of their last name, because of the color of their skin, their hair texture, their eyes, and we make assumptions. But those assumptions could be entirely wrong. I've had clients that in Central Texas who were American Samoans, and by their self-identification of being American Samoans, stated that to their knowledge there was no racial mixing within their family at all. Yet in the clinic, they wanted to know why I wasn't performing certain tests on them that you would for someone who came from another racial ethnic group. And the staff made an assumption based on how people looked. And so I think it's important that we ask. And when we ask, that we give people a rationale that they will understand as to why we're asking. Because that's really a very personal question. What race am I? What do I identify as? While one way I'm very happy that you asked me, I could also be very offended at the fact that you did. So I always find explaining to patients why I'm asking the question, how it's going to help me to help them decide what kind of screening tests they may need, what kinds of things we need to look for. In the community, the language will determine how you provide people health care, how you give them information, and their ability to use that information to make decisions. So the ability to give people information in their language is empowering. But if we don't know that a certain part of a community has members who speak a certain language or would prefer information in a certain language, we don't give them that information. We make assumptions all the time. I've had people make the assumption, and they actually were part of a specific ethnic group, that I was a part of that group, and I was not. And I kind of smiled when it was said to me by the clinic director that, oh, the staff asked, well, we won't have to translate. And she looked at them and said, well, why will we not have to translate for this provider? And they said, well, she speaks Spanish, doesn't she? And she said, no, she doesn't. I know a man whose name is Ziegler. Someone came up to me one day and said, how did he get that name Ziegler? Because he happens to be black. I said, the same way you get the name of Johnson or Smith or Rodriguez. You can't make an assumption. He's not German just because his name is Ziegler. So I think it's really important that we ask clients and that we're comfortable in asking them and comfortable in presenting to them the reason why. And so we think that this training today will help you to develop those skills or refine the skills that you may already have. And so you're going to be looking at doing an exercise with National Geographic that will help you maybe look at some perhaps preconceived notions that you may have yourself, and then look at ways on how you can change those. So I hope that you will find the exercise both interesting and challenging to you, so that will help you provide better care. Thank you.